In this PowerPoint, I will be pronouncing extra oral and intraoral landmarks. And this is for pre-clinic discussion. We're going to start off with doing the extra oral landmarks, which are shown on this slide. You have the submental, submandibular, pre-auricular, post-auricular, occipital, and then you have your cervical nodes, which is down your sternocleidoid mastoid muscle. And then we check the thyroid, make them swallow. And then we have the parotid, and to check the TMJ. In this slide, you can see the lips, which consist of the vermilion border, the vermilion zone, the commissures, the philtrum, the tubercle, and underneath the lower lip, you can see the labial mental groove. Now in this slide, you can see that we're now in the mouth, and we're looking at the hard palate and the dorsal side of the tongue. And you can see on the sides the buccal mucosa, which is your inside of your cheeks. And so we will start out with the palatine rugae, palatine raphe, fovea palatine, the hard palate, maxillary tuberosity, the soft palate, the pterygomandibular fold or raphe, and on the tongue you have the median sulcus, the filiform papilla, and the fungiform papilla. And the things that you cannot see that's not labeled on here would be the mucobuccal fold and some frenum attachments on the buccal side, the labial side, and the lingual side, which you will see here soon. In this slide, it's going to be very short, but the arrow that it's pointing at is called the linea alba, and above that, a little bulbous gland called the parotid papilla and the Stenson's duct is above that line, and it's on both sides of the buccal mucosa. I forgot to mention in the hard palate, right underneath the palatine raphe is the mid-palatine suture. Now, in this slide, you can see the soft palate and the oral pharynx. You can see the uvula, the anterior palatine pillars, the posterior palatine pillars, and in between those you can see the palatine tonsils. And behind that you see the fauces, and behind that it would be the posterior pharyngeal wall. In this slide we will be covering the dorsal side of the tongue, which I know I already went over 2 of them, but I would like to do it one more time just to make sure. You can see the filiform papilla and the fungiform papilla, the foliate papilla, the circumvallate papilla, and behind that you can see the terminal sulcus, and behind that is the foramen cecum. And in the middle of the tongue you can see the median sulcus. In this slide we will see the ventral side of the tongue, which consists of the lingual frenum, the sublingual veins, and the plicae fimbriata. And then the sublingual folds down at the bottom, and the caruncles, which are the Wharton's ducts.